Good afternoon and welcome to the Health Leaders Patient Experience Now Online Summit. My name is Jack O'Brien and I am an editor for Health Leaders and will be your moderator for today's webinar. Our upcoming session is titled The Digitization of the Point of Care, How Greater Connectivity Can Transform the Delivery of Care. This webinar is brought to you by Midmark. Thank you to our sponsor and to you and our audience for giving us your time and attention. Before we get started, I have a few housekeeping details. Our program this afternoon will be 60 minutes in length. Note that an on-demand version of this program will be available approximately one day after the completion of the event and can be accessed using the same login link that you used for the live program. To ensure that you can see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resources list for today's webinar in the upper right-hand corner of your screen. Here we have listed the webinar slide deck and other resources for you to interact with. At the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left-hand side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our speakers. Julie Heinrichs, Senior Marketing Manager for Midmark Corporation, and Tracy Timmerman, Marketing Manager for Midmark Corporation. Thank you both for taking the time to speak with us today, and with that, the audience is yours.
All right, thanks, Jack. Appreciate that. Julie and I, we've been looking forward to the webinar, and we really appreciate the opportunity to spend this time with you all today. Like Jack introduced, we are from Midmark, and at Midmark, we're really focused on improving that experience between the patient and the caregiver. What we do is we design the clinical ecosystem on which many physicians practice medicine, and this is going to include things like your exam chair, your lights, your stools, cabinetry, diagnostic devices. And we bring all of that equipment together through coordinated workflows with a focus on many of the critical elements such as patient and staff safety, good ergonomics, and enabling good clinical outcomes. But today we're really going to focus on the connectivity at that point of care. So at the end of today's webinar, you'll have a greater understanding of the benefits of a connected ecosystem. You'll learn how to avoid many of the issues that were presented when digital record keeping was first introduced. And we'll also cover how to maintain that in-room experience between the patient and the caregiver. We certainly don't want technology to interfere with that experience. And then finally, you'll be better equipped to determine which connected technologies and devices will lead to successful operations and clinical outcomes. So with that, we'll dive right in. There's definitely a growing need for connected technology and devices in the market. Patient information, we really want it to be readily available at the physician's fingertips, right at the point of care. So within large health networks with several facilities, we really want physicians, they need to be able to access patient records and lab results, really no matter which location they may be working from for the day. So we understand there's this need, but it's really challenging to integrate technology seamlessly across several systems. So to get all systems integrated and talking, it's not an easy task, but ideally you want vital signs to be able to be acquired in one location and have the ability for a specialist, for example, in another facility to be able to pull up those test results and analyze and interpret that data. So, and of course, all of this needs to be done while still optimizing that patient-caregiver experience. So Julie's really going to touch on this one a little bit more in depth throughout the presentation, but oftentimes that humanistic aspect involved in the delivery of care is lost. So that interaction really needs to be given some attention to ensure a good patient experience. So we know that there's this need for connectivity, and this need is really paving the way for digitization at the point of care. That information, it's really the lifeblood of good medicine. And if you think about it, virtually all of the tools that a physician uses in medicine, whether it's your labs or your imaging or maybe your physical exam, These are essentially, they're simple data gathering tools, and these tools help collect the data that's going to set the foundation for determining care plans and intervention decisions. So, of course, just having more data at the point of care isn't enough. It really needs to be accurate, relevant, and actionable. So, to ensure that good data is collected, consider what can be standardized, such as BP measurement, for example. BP measurement is captured in nearly every patient encounter, and it's an important factor in point-of-care diagnosis, patient risk classification, and medication dosing. So even if you have slight variations in technique and measurement, those variations will have a big impact. So to avoid the variations, it's really important to be able to capture BP the same way every time to ensure that you're getting that accurate and repeatable data. You also want to consider equipment that can truly be integrated with an EMR. Remember earlier I mentioned a need to have vitals be taken in one location and then have the ability for a specialist in another facility to pull up those vital results and interpret that data. So for an example, an ECG could be taken in one location, and then perhaps a cardiologist at another facility should be able to pull up that reading and analyze the waveform. So in order to have this ability, data needs to be integrated. This integration is critical and really gives that rich data that can really be analyzed versus just an interface. So throughout this presentation, you'll hear Julie and I talk about interface versus integration a few times throughout the webinar, so I really want to make sure that the difference is understood. So if you think of an integration, it's kind of like taking a picture with a smartphone, for example. So once you take a photo on a smartphone, you can do a lot with it. You can email it, you can upload it to your social media account, all within that one tool. An interface is more like a point-and-click digital camera. You still get a picture with it, but in order to do anything with it, you might have to get an SD card out or a cable, plug it into your laptop or computer, and save the file down, and then maybe rename it, and then you can start to do some things with it. So that's more of the interface. So when considering digitization at the point of care, you want to integrate data wherever it makes sense, such as an ECG test. All right, so far we've talked about the growing need for connectivity with advancements in technology and how to bring digitization to the point of care with data integrations. So now you should start to be seeing some of those benefits that would come with a connected ecosystem. And it truly transforms the delivery of care and enables a better experience and delivers better outcomes. So when you have that accurate and actionable data available right at the physician's fingertips, not only does it improve outcomes, but it also allows the physician to more effectively use their time with patients at that point of care. Remember, we don't want that technology to interfere at all with the humanistic aspects of care. So giving that physician the time to focus on the patient is truly a must. And then with a connected ecosystem, transcription errors can also be reduced, which is a huge benefit that we're seeing. We know that there's about a 17% error rate associated with manual transcription. So you want to eliminate or reduce any manual steps that can lead to this error. So, for example, if all vitals and weight can be collected in one location within the exam room and taken in a standardized way, and then if it can be automatically pushed to the EMR, there's less clicks, less manual steps, which is only going to increase efficiency while reducing those errors. This is also going to lead to patient staff safety. So if you can do everything from the point of care, the exam room, you can take the patient's weight and all their vitals from the exam chair in the exam room. That patient is no longer having to travel throughout a hallway or to a triage nook to get their weight and then be transferred to another exam room for the rest of their vitals. All of it's right in that point of care. So again, just increasing their safety, reducing their risk of acquiring some infection as they're traveling throughout that hallway or triage nook. So And then finally, a connected ecosystem, it's also going to start preparing the exam room for future technologies such as artificial intelligence and machine learning. And these advanced digital analytic tools such as AI and machine learning excuse me, are really changing how clinicians manage patient care. So a good, accurate data is collected in a connected ecosystem, and that data can then be analyzed, and treatment plans can start to be determined. So again, good, rich data collected in a standardized way can be used in more of those advanced tools such as AI and machine learning. You'll also have the ability to start to merge disparate data sources with modern smart analytics. Remember I mentioned that there can be data across several facilities perhaps, but that data has to be merged and made available at all locations and specialties. And this is really made possible through integration and connected ecosystems. So in the last couple of slides, we covered many benefits of a connected ecosystem, but one thing that certainly cannot be overlooked is the need for this seamless integration, which Julie is going to walk us through next.
Great, thanks, Tracy. So as Tracy told us, there is a growing need for connectivity. How, at the point of care, where the data, and not just data, we're not talking of that data coming in, but she mentioned the rich data, right? Rich data is the lifeblood of good medicine. So the intent, again, is to have more data sources, right, at the physician's fingertips. And a connected, digitized ecosystem will ultimately transform the delivery of care. But the transformation into a digitized ecosystem needs to be seamless. And here lies our problem originally with EMRs, right? So next I want to talk to you about some of the challenges around that technology integration. So as technology is integrated into the exam space, we mentioned it must be seamless. And if we look at a fully connected point-of-care ecosystem, this can be complex. And there needs to be a balance of that new technology. Think of new innovations that support diagnosis. And there needs to be a balance of the connectivity. So, connecting directly into an EMR. And then also the workflow has to be kept in mind. So you want to, enhance that workflow to improve those clinical standardizations, right? Tracy talked about the acquisition, IDNs, and that continued standardization of clinical processes to create consistent and accurate and repeatable processes. And that's really, truly the end game there, right? So if we do this all correctly, we'll realize greater efficiencies and we'll enhance that patient-caregiver interaction. And ultimately, the end game is to contribute to better clinical outcomes. So while there's a lot of discussions surrounding greater connectivity and the advantages of it and the digitization of the point-of-care ecosystem, it can certainly be challenging to integrate the technology seamlessly, right? And to ensure, as Tracy mentioned, that intimate and humanistic aspects involved in the delivery of care and ensuring that it's maintained. So we look at the introduction of the EMR to the point of care, and this shows us what happens when it's not seamless, right? So since that introduction of the EMRs, we've had seen, longer wait times. We had decreasing patient satisfaction, and there was caregiver burnout. Many physicians and patients viewed the EMR as actually an intrusion in their space. So much of this was because the EMR screen became a barrier, right? And that's the one thing you want to do is to eliminate any barriers within that space. So the EMR screen created a barrier between the interaction between the physician and the caregiver, or the caregiver and the patient. So with the physician spending so much time either entering data, staring at the screen, and then the patients were literally staring back, either at the back of the physician's head because of the layout of the room, or either at a laptop. So, there's just all this, with that EMR integration, that barrier, and here's a stat for you when you think of the EMR and that integration and even that translating that data. So it takes 1.6 times more to gather a vital signs in a traditional workflow versus an integrated vital signs acquisition at the point of care. that's going to decrease the staff efficiency by 5%. And as if that wasn't telling enough, those manual entries and manual transcription errors, as Tracy mentioned, are at a rate of 17%. So diagnostic devices need to work seamlessly with that EMR system to help improve the workflow, save time, and eliminate those manual transcription errors. So the wide-scale adoption of these EMRs was certainly, a disruption initially. The original intent was for that this was going to be a pivotal time for improving patient safety and healthcare quality, and the expectation was that these EMRs were also going to reduce the cost of providing ambulatory care. A lot of these objectives, right, you'll hear the same objectives we'll talk about throughout this presentation, were established by CMS, which is the Center of Medicare and Medicaid Services, and they're to improve patient safety, to support the delivery of effective care, and to facilitate chronic disease management and improving efficiency. So ultimately, their goal is to move from that fee-from-service to a value-based care. So, however, despite emerging evidence about all of these benefits of the EMRs, there are still considerable barriers to the adoption. And because physicians have that central role in the EMR, they're the ones, entering the data, providing much of the information within that system. So definitely that was a time in which, there was that patient-caregiver interaction, and there was a loss of that. And I've even heard of caregivers who documented and entered data in the evenings because they didn't want to, go against that time that they had with their patients. So definitely a time of disruption. So in summary, as those EMRs were introduced, the intent, like I said, was to have this influx of great digital record keeping intended to improve the healthcare industry. And what they realized is that this technology wasn't necessarily designed with that patient-physician relationship and that interaction in mind. So again, many physicians, saw this as an intrusion, and not surprisingly, the patients did as well. And a lot of patients didn't really feel that this was necessarily making their healthcare experience any better. So the initial onsets of EMRs and that disruption was really, really tough in that patient-caregiver interaction. And so as a result, many physicians even became very tech-averse. And because it became intrusive with their relationship with their patients, like I said, became tech-averse, and they didn't really want to spend their time in the EMRs. So there were certainly lessons learned, right, using these EMRs. And after the initial disruptions, EMRs are now finding their place in the point-of-care experience. Physicians are really starting to see the digital records and the multiple data sources for a patient versus one. So it's almost thinking like, a linear versus having parallel paths. They've got all this data now that they can bring at their fingertips versus having that one source of data at a time. Patients and physicians are really starting to see the benefits as well because, again, as Tracy mentioned, that accurate and relevant and actionable data at the point of care. So because we are starting to see those benefits, we want to talk about understanding that there's benefits now and what we can do in room considerations to help us ensure that we're doing the correct things there. So now that we talked through those challenges, the EMR on the introductions, and what we learned during that time, and now we are starting to realize the benefits of EMRs and also having that accurate, actionable data. Now we can apply some of the lessons learned in these in-room considerations. So attention certainly needs to be given to the design, and this has never been more important than in health systems today. Practices and providers are continuously looking for approaches that bring together workflows, technologies to support increased efficiencies and safety, and not only patient safety, but caregiver safety. We talk about caregiver burnout, and ultimately resulting in improved outcomes. So they know how critical the point of care is, and as this is that patient has their first key interaction with a healthcare provider, and healthcare providers know the focus needs to be on that patient. So in today's patient-focused value-based care environment, design has evolved into almost a strategic component of the point-of-care ecosystem. And so designing to ensure you do not have those barriers, and we'll talk about several of those barriers today, within the exam space is imperative for the success of that workflow. Barriers come in all forms, though. So don't just think of equipment and the location of equipment, but barriers can also include electronic barriers. And we'll run through several of those areas of designing in-room considerations. So first, an in-room consideration is limiting these electronic barriers. So what this means is, give careful consideration to exactly how technology is supported and integrated in the exam room at the point of care. It's not just great to have technology, but to ensure that technology is working within that space. Ensure that it's valuable, that the time shared between the patient and the caregiver is still at the highest priority during that patient's journey. Ideally, in-room digital technology should be invisible. It should not be creating a barrier, and whenever possible, to preserve that interaction that happens during that patient visit. So what we say is, whatever clicks you can reduce, and even eliminate them if possible, because you want that data to flow directly from when you're taking acquisitions, directly from the connected devices into that interface or that integration. And we want to make sure that's optimized for efficiency. So if a computer interaction infringes on that critical patient interaction, then reanalyze it. Get rid of whatever those barriers are within that space. And physicians know this, and so their whole goal is that time that they spend between that patient and their the caregiver is of the utmost importance, because they only got a certain amount of time with those patients while they're in that space. So changes may need to be made, equipment, or even placed or configured differently in the room. So technology does not become the focus, and make sure that the patient is always the focus and there's no barriers created within that space. So in order to limit, the electronic barriers, it's important to make the data entry seamless. And Tracy talked about this earlier. And we talked about on one of the last slides about reducing the clicks and how can we improve the steps that a healthcare provider needs to take to get the data entered into an EMR. So when ordering tests, this needs to be completed with, like I said, as few clicks as possible, but allowing the physician to spend less time on the data entry and focus more on the patient. We want to talk about the EMR integration versus an EMR interface. And with an integration, you can enable a seamless workflow in a patient's charts from the ordering of tests to the acquisition of the test, reviewing the test results. And you can do that all without leaving the EMR. That's an EMR integration. And this creates a digital workflow, ultimately saving time and eliminating those manual transcription errors as we talked about. Connected equipment and devices at the point of care, when operated, what is called in a single pane of glass, enhances that improved efficiency. And that's what we're talking about with this integration, is a single pane of glass. It simplifies the process, and by single pane of glass, we can unify the data from several interfaces across multiple sources and represent that data in a single view. So, for example, vital signs measurements should find their way automatically into an EMR versus, opening software, saving a record, and then in some cases, and I know one EMR, there might be an interface where it might dump the data into the EMR, but then they have to do a date-time stamp search. So they have to search for the data, they have to validate the data, and in a lot of other cases, if it's an interface, they don't even get that transfer into the EMR to search for it. They've literally got to translate that data into the EMR. So often when it comes to improving these care interactions, we think that these little steps are just little things, and they're quick wins. But by creating a single order system for test and acquisition, you eliminate all of that non-value add, the screen navigations, and the problems that come with it. But just to talk about it, those little wins create great efficiencies, and they reduce errors. And think back to Tracy's analogy of the point-and-click camera versus the iPhone, and how that iPhone, since integrated into social media possibly, makes posting something or a picture seamless. And that's the same steps you're taking with this EMR integration versus an interface now. So as we look at another in-room design consideration, choosing the right equipment is another important aspect. Equipment and technology design is important, but it needs to be a holistic design approach in order to really enhance the healthcare experience. Again, you want to improve those clinical outcomes, you want to increase operational efficiencies. So I always look and say there's three main components that should be examined for the success. Equipment and technology are one, and a lot of people do focus on the equipment, the technology, what they want in the room, but there's three components, I think, for success here. One is your facility design, right? Are you doing on-stage, off-stage? Do you need ADA compliance, self-rooming? What's the facility design, that overarching design? And then, as I mentioned, the equipment and technology that goes into it, and the designs that you need to ensure that it works with that space. But then after you talk facility design, equipment, technology, then there's a whole other component of workflow, right? The workflow within the space, and ensuring through workflow, you're not creating barriers. Through the equipment you're choosing, you're not creating barriers, because at the end of the day, you want to remove any barriers you can in that exam space, because that time and the data that you receive with that patient is so fruitful, right? You want to make sure it's at the highest point. So design considerations, including the right equipment, is imperative to achieve better healthcare experiences. And choosing exam room equipment that is designed with modern and digital technologies in mind is definitely key. These technologies can impact numerous steps in the care journey, right? The exam room layout needs to consider how the technology attributes can be optimized for workflow considerations, just like I mentioned before. So by connecting equipment and devices at the point of care and operating them all from that single pane of glass, that one computer screen, this can improve efficiencies, simplify the processes with fewer clicks. An example of this is using an exam chair that serves as a scale, right? If it's connected directly to the patient records and seamlessly into the EMR, you may be taking their weight as they're sitting on the exam chair, versus having them out in the hallway taking measurements. You introduce patient safety, you introduce caregiver safety, your transcription errors again. So there's all kinds of things with just choosing that equipment and, again, that connectivity. Another example would be a computer workstation. You'll see in the slide we have in here. The workstation or a wall unit can be selected to ensure that you have eye-to-eye contact. And this can be maintained as much as possible during the times of data entry if you use a piece of equipment that allows you to maintain that eye-to-eye contact. So if you have major flows, such as having computers and keyboards, these are easy things that you can do right away, and ensure your patient's always facing, the clinician as they're going through designing those exam room layouts. So the last in-room design consideration is to integrate technology wherever possible. You want to eliminate the human intervention and reduce those human transcription errors. Auto-populate dashboards and templates wherever you can to eliminate the unnecessary data handling. As mentioned earlier, those manual transcription errors occur around a rate of 17%, and that's pretty significant in itself. But think about that. That's 1 in 6 patients whose records could be inaccurate. So when we examine ways to eliminate that human intervention, the integrated system, again, aids in this objective. You can integrate or interface with an EMR, and when software interfaces, there is always 2 or more separate software products communicating, and you just get limited data. So besides this great translation of data into the EMR, you also get more fruitful data. And I talk about that a lot, and Tracy brought it up a little bit of the ECG And if you actually have a physician who's done the ECG, but yet a caregiver in another location who can actually pull that up and interpret it, that's really fruitful and valuable information versus a static, say, PDF. So ultimately, technological innovation, when seamless through integration, eliminates that human touch and helps improve efficiencies and drives the consistencies. If successful, this won't create barriers and infringe on that patient-caregiver experience. And we keep talking about that, but that's why physicians become physicians, right? They want to take care of people. They don't want to enter data into a computer, right? So this produces that more valuable data for the physicians too, and data is king. And again, as we've been talking today, this is ultimately, if we do this all correct in this seamlessness, in this point-of-care ecosystem, it will improve patient outcomes. So that wraps things up from my end, this discussion about the challenges with technology and the design considerations. The digital transformation at the point of care is an incredible shift for healthcare market. The greater the connectivity, provided some without adding those barriers, right? The more fruitful and beneficial the data that our physicians will have at their fingertips. So I'm going to pass it back to Tracy to wrap things up.
Great. Thanks, Julie. Yep, so just like Julie said, to wrap it up today, really when done correctly, introducing the digital technologies and creating a connected digital ecosystem it drives so many benefits that we've covered today. A fully connected point-of-care ecosystem that balances the new technology, connectivity, and workflow, that's really going to enhance that point-of-care experience. It's going to strengthen the patient and caregiver interactions, keeping that at the focus with the technology running in the background, and it's improving the clinical standardization, which then leads to those greater efficiencies. Just like Julie said, then that all drives those improved clinical outcomes. So again, that wraps it up. Again, thank you all so much for your time today. Julie and I, we really appreciate the opportunity to speak with you. So thank you so much. And now I'll pass it back over to Jack for some questions.
Wonderful, and thank you so much for your presentation. Very insightful for our audience, and certainly appreciate you taking the time to walk us through that. We are now going to transition over to the Q&A portion of the program, which I had mentioned earlier. We have a widget that allows those of you in our audience to ask questions of our speaker. We've had some questions that came in during the presentation, but obviously want to open the floor up to those in our audience to send in questions, anything they might have for the folks here from Midmark. So as a reminder, to submit a question, click on the Q&A widget at the bottom of your screen. It may be open already. It's here on the left-hand side of your screen. Please note that your questions will remain anonymous and will not be viewable by other audience members. So like I said, we've had a few questions that came in during the presentation, but we're going to start off with one for Julie, which is, what are the greatest benefits of a connected ecosystem?
All right.
I'm going to have Tracy take that one. Thanks, Tracy.
No problem. So I did cover a couple slides there on the benefits, but there are so many to list. One of them is probably just the greater visibility that you gain. Again, we talk about, the need for records and test results to be available in multiple facilities at different locations. So just the ability to have the visibility to those reports at all locations. And then one technology that we really didn't talk about too much through the presentation is real-time locating system, especially through, as you're trying to monitor your efficiencies of your workflows that are set up and maybe gain, where are you today, and then track your progress over time. That real-time locating system can help track your workflow. It also does asset tracking. And then with COVID-19, it was a vital part in contact tracing as well. So that real-time locating system definitely adds to the visibility as well. We talked about standardized approaches as well. The more you standardize, if you have people doing BP the same way every time, that's only going to give you a nice foundation of a good data set. And then with that standardization comes those greater efficiencies that you'll realize, and then ultimately enhancing that patient-caregiver interaction keeping that at the forefront. So those what I'd say are the benefits. Julie, would you add anything to that, or?
No, it all boils back to enhancing that patient caregiver experience, as we've been talking about the whole time, and how you use these connected ecosystems to ensure that you're not creating those barriers that we talked about. So great, thanks, Tracy.
Appreciate you answering that. We've had a few questions come rolling in here. We have another one. What would you recommend as the first step toward a more connected ecosystem?
I think first you really want to determine what your EMR roadmap may be. Oftentimes, if you've gone through acquisitions, you may have multiple EMRs. Maybe you're standardized, maybe you're not. So what is your EMR roadmap? Where are you today? And then what's your desired future state? And then I'd also recommend just determining what you want to standardize, what hardware and workflows do you want to standardize on. And again, that standardization is really required to get that good data to connect.
Yep, and I'd agree with that. I was just going to add in, as we talked about today, the opportunity to look at, integrating versus the interfaces with another, when I look at those steps. So as Tracy said, certainly looking where you want to be, but then obviously as you dive into just not buying technology to buy technology, right, to ensure that the connectivity and how it works with your workflow as you go through that journey, it's also important to keep all of that in mind. So.
Got a question here. What is an example of integrating equipment directly to the EMR seamlessly?
I'll take this one, Tracy. So a couple of examples. I mean, if I look at, even a spirometry, we talked about an ECG, a spirometry, same way. If this is integrated into an EMR, there's steps taken. If you're not seamless, if you're not integrated, you're going to open up the software, you're going to acquire the data, and then, like I said, you may have to search for that data within an EMR, but a lot of times you have to translate, or a lot of times, with a spirometry, with an ECG, they're going to upload a PDF. And so the PDF is definitely not integrated, and this also isn't seamless. So to interpret that PDF versus having real-life data that you can physically move the calipers on, say, an ECG or a spirometry reading, you may be able to interpret the data. Look at also even understanding the trends within the data within that patient's record. So that's one example of integrating equipment directly into an EMR. I mentioned the chair as well, and having that chair be able to weigh a patient in the exam room and directly uploading the information again, not worrying about the transcription errors, ensuring you've got the weight documented correctly. And this is really important. Tracy talked about, vital signs or your BP acquisition. It's so important. Your weight is an important factor just for your medications. So having that done and having it done accurately and ensuring that those records are updated correctly is super important. We talked about that 17% transcription error. So wherever you can seamlessly integrate versus interface with the EMR is super important. So there's two examples. Hopefully that helps out a little bit.
Sorry, it probably would help if I took myself off mute here. We have another question that came in here, which is, what major EMRs does Midmark work with?
Yeah, so I'll take that one as well. We work with the major EMRs. I know there's probably two or three big ones that make up 60 to 70%. So, talking Cerner and Epic, Centricity, Allscripts, Athena, GEMS, and there's more of them in the portfolio. And we're always continuing to work with those EMRs and ensuring that we're continuing to update that software, continuing to have new EMRs added into the portfolio as well. So, but those are the major ones, and they're the ones that most are familiar with, I would think. So.
So I want to ask our audience one more time if they have any questions. Really appreciate all the answers that we've gotten for our audience going through this Q&A session, but we're going to do a final call here. If anyone wants to submit, use the Q&A widget at the bottom of your screen. Not seeing any. I think we're going to wrap up here. Oh, nope, we got one that just came in. How does increasing positive patient identification at check-in fit into this picture?
Increasing positive patient identification. So you're talking, I'm sorry, can you, is there more to the question there? Increasing positive patient identification just in the EMR or within?
There is nothing beyond what I asked in the question. How does the increasing positive patient identification at check-in fit into this?
Well, obviously, a patient comes in and having, ensuring you have the correct records, if that's what we're referring to, is obviously, but I'm not sure beyond that. I'm not sure the question.
Well, and I'm wondering too, it made me think of it was RTLS and real-time locating system. You can, when you have that technology connected, the patient in some cases can even avoid the waiting room, which only increases or it reduces the likelihood of them contracting an infection in the waiting room. So we have had there's interest in that with the real-time locating to identify the patient where they can go directly to the waiting room. So that's how I may be interpreting that question as well. But again, another piece of technology with that real-time locating system.
Okay, I appreciate you working through that question. We did have some clarification there about it being one patient to one record. But I want to thank our audience for sending along these questions, and certainly any that didn't get answered, they will be passed along to our speakers here. But that brings an end to the Q&A portion. I want to again thank our speakers for a wonderful presentation today. I want to remind our audience in closing to please note that if you registered for the next webinar of the summit titled Going Beyond Intervention, Data, Trust, and Personalized Patient Care, a live clickable link will appear in your slide view in just a moment to go directly over to that program. If you have not registered for that program and wish to attend, you will need to click the link and fill out the registration form to gain access. I want to again thank our speakers for a wonderful presentation. I'd like to thank Midmark for making this afternoon's program possible. And finally, thank you and our audience for participating this afternoon. We hope you enjoyed the session and look forward to seeing you during other webinars for this summit.
Great, thanks, Jack. Appreciate it.